Hi everybody, this is LaShonda the Warrior. I need to make sure first that you subscribe to this video, please. Okay, we want to make sure we get the awareness out there. I apologize for not doing another video in between the first one. My plan was to do one every week. However, I had my first treatment of chemo about a week and a half ago, and I was not expecting to feel like I felt. And right now I have a cold. I got picked up for my daughter, so I'm struggling to work through that. But I did chemo on the 29th, which was a Wednesday, about 9 that morning. I began to get sick about 3 a.m. on Thursday morning, and I've never experienced anything like that. I was extremely nauseated. I was so weak. I really couldn't move, couldn't get off the couch. I really lost concept of time. I didn't know what the day was, what time it was. I thought 6 p.m. one night was actually 6 a.m. the next morning. So I was so disoriented. I only ate from that Wednesday to, and I'm sweating, I just got a shower. That Wednesday till Monday, I only ate a cup of soup and about a half a cup of mashed potatoes. That's all I can keep down. I finally went in Monday to the cancer center, and they gave me some IV fluids and some meds for nausea, and I felt a lot better when I left there. So I was kind of up and moving around a little bit by Wednesday, but then the cold started coming on, so I've kind of been a little lethargic since that. But I know I told you before that I was going to be doing the cold cap therapy to help preserve my hair. And again, it's not about vanity or the hair loss. It's about maintaining control through this battle. It's about having some normalcy in my life. So I want to just talk a little bit about the side effects I've experienced since the chemo first. Other than the nausea and the slight vomiting, I've also had skin changes. I don't know if you can see like little fine bumps that almost look like a baby's diaper rash all over my face, and it's really dry. My skin is normally super oily, but it's been very, very dry. I also got thrush really bad, so that's another reason I couldn't eat, because every time I swallowed, even taking in liquids, it hurt and burned my throat so bad. So when I went in Monday, he looked and he said I had thrush. So see those two little dark spots are kind of residual left on my tongue. My tongue was really nasty. It was coated in white film. And it was really disgusting all in the back of my throat. So it's kind of like when an infant has thrush. So they prescribed the nystatin for me to swish and swallow. They also prescribed the magic mouthwash, which has a lidocaine in it to help numb. And that helped with the pain of me swallowing, because it still was really difficult even with the nystatin. I still couldn't really eat or drink, and we didn't want me to get dehydrated. I think I had lost like 4 pounds from Wednesday to Monday, and that's not good at all. People were up saying, oh, that's great. That's not good. You don't want to lose that much weight, especially because you're dehydrated. So again, I'm doing the polar cold caps, which basically are like ice packs inside these caps. We wear them an hour before chemo. So normally while I'm getting my pre-meds, I have them on, switch them out every 30 minutes. I wear them for every 30 minutes during chemo, for 3 hours after chemo. When I tell you, that was the coldest thing in the world, because they're negative 38 degrees Celsius. My head was frozen. I wanted to rip my scalp off. That's how cold it was. I actually freaked out at one point, and I snatched the cap off, and my sister came over there and shook me and was like, you gotta put this cap on your head. It took me 30 minutes to get this cap off, you know, but I started panicking, and I had a mini panic attack. But after, you know, I got used to it and adjusted and just tried to focus, I was able to do okay. So, you know, it is kind of expensive. I rent them the $375 a month with a $375 security deposit. And I'll put the link in the comments down below and there's different companies. I'm using Polar. There's some other different companies out there, but that's the company I chose to use. So washed my hair for the first time today, and I bought the shampoo, and it's very pricey too, because it said to use something very pure and very gentle, and it's called Pure Biology. It has biotin in it, so it says designed for hair growth stimulation and anti-loss. And I also have the conditioner as well. And I ordered those off Amazon. I think they're about $30 a piece. But oh my gosh, my sister washed her hair in it first, and it felt amazing. So this was the first time I washed my hair. I combed it a couple times, and I am natural, no relaxer. I usually wear a sew-in or a wig, but I have not been wearing anything lately. So this is where I am still after one treatment of chemo. I think most of the time they say hair loss starts about a week or a few days to a week after your first treatment. I've had minimal hair loss. I combed through my hair a couple times. I was scared. So I have a wide tooth comb. I combed through it, and again, it was minimal hair loss. I mean, I probably have more normal shedding than that on a regular basis. So it was minimal. But let's see. I mean, there's like one strand in there. So you have to be really gentle with your hair, though, during this process. No flat ironing, no blow drying, no pulling or tugging, meaning I can't do a sew-in. You won't want to do a sew-in anyway if you're doing the cold caps, because the caps need to get down to your scalp, because what it does is constrict the blood flow to your scalp, preventing the chemo meds from getting to your hair follicles and helping to minimize hair loss. There's no guarantee that it can completely reduce hair loss or you will keep all of your hair. There's no guarantee, but they have success, I think, with most of their patients retaining about 80% of their hair. So, you know, if you can afford to do it and you want to do it, it's worth it. You know, you got to kick cancer's butt. Cancer takes so much from you. Whatever you can maintain, then you do it, and you take that control back, you take that power back, and you be the warrior that you are. Okay, so I'm going to try to figure out how I'm going to style this stuff. I'm probably just going to put some leave-in conditioner in there and maybe pull it up in a bun or a ponytail. So that's it. I have my second treatment on Tuesday. I'm going to just pray that it goes okay and I'm not as sick. They changed my treatment regime. They're going to have me coming back in the next day, because I have to go in the next day anyway to get the new LaShonda shot to help boost my immune system. So instead of me coming back just to get fluid as needed, they're going to go ahead and give me fluids at that time to see if that helps and minimize the sickness. So we're going to try that, and hopefully I'll be able to do a video next week. So again, thank you. Don't forget to subscribe. We are warriors, and we will kick cancer's butt. Warrior out.